I've talked about a number of the challenges already. Burden of ill health continues to grow, and it will. We were at a NATSIWA workshop yesterday, which is the National Health Worker Association, and the chair was talking about her own personal experiences and her passion around being involved in such a peak body. And she said, this isn't going to stop, she doesn't want people to focus on her health needs so much. She wants the health needs to be focused on her grandchildren. She said, she's got a 65% chance of ending up on a kidney dialysis machine in another 5-10 years' time. She said that doesn't bother her. What bothers her is her grandchildren, because we know that chronic disease and the burden of ill health has been around for so many years. She's been fighting it, trying to advocate for it for so many years, but now her focus and her commitment for this is for her children and her grandchildren. There is still a greater need for resources than are available. Like I said, with my role being the Workforce Policy Officer, whenever anyone mentions workforce, it's basically to me. And that's not an easy task. When you look at someone like the Department of Health, who have got 2 separate units of workforce people compared to my one position, it's not easy dealing of the national level, the NT and local level, on reference groups, on projects, dealing with policy and representing our member services in one full-time position. And I suppose that's another example of why we created the Workforce and Leadership Support Unit, to try and support ourselves and trying to build the capacity of what we do to meet our member services needs. The high proportion of patients in the Archers have complex problems requiring longer consultations, and demand makes it difficult. Like I was mentioning before, with many clients having to go to GP services just to meet immediate needs, it is quite difficult. There is limited access. There is only so much you can do. With health services, they have the same problems with workforce shortages, with high staff turnover. These are a number of things that the health services are having to constantly deal with. To their credit, I think they deal with it well, particularly when the community expects so much of them and cannot understand why it is so hard to get certain health needs met. They're struggling, and any more resources, any more workforce, GPs, nurses, health workers, they're always needed within the health services across the NT. And within the advocacy role, even though we talk about that as being one of our core roles and functions, it's very difficult. There is only so much we can actually advocate for, and I think that's where that partnership comes into it, to build that capacity to be able to increase the advocacy and lobbying around particular issues. Housing is one of the probably most critical, as well as education and employment, but housing is such a huge issue, and I'm sure many of you know that Darwin is quite an expensive place to live, but remote communities in particular find it very difficult to be able to accommodate the housing.